Right, lads, we need to take a serious look at your ball skills. Most of you are letting the side down big time. Let's get some facts straight, shall we? Testicular cancer mainly affects men between the ages of 15 and 44, and that includes all you lot. It affects nearly 2,000 men every year in the UK. It doesn't matter if you're white, black, rich, poor, or even old Golden Balls himself. Everyone needs to know about this. So what's our game plan? It's all about catching it early. If you do that, there's a 99% cure rate. This is not something your mum can check for you, and if she does, we'll have to have some serious words. You've got to take some personal responsibility. I've seen you lot on the pitch. First sign of any danger in the wall, and your hands are down there protecting your tackle, not your pretty faces. All it takes is 3 minutes every month or so. That's less than injury time. And even if you don't have the top medical facilities of a big club, you find anything abnormal, get down to the doctors and get it checked out. Right, you lot, you got that? Right, go see the physio for a once-over. Well, come on then, you're still here. And what are you waiting for?
It's about time we cleared up some myths around testicular cancer. It's not caused by trauma. You will not get it if you get kicked to the nuts while you're playing football. And you can't get it from microwaving your food. You might be more at risk if your dad, your brother or son have had testicular cancer. If you've had undescended testicles as a child, this is when your balls fail to move from the abdomen to your scrotum when you're young. You may not have known at the time that you ever had it, but you may have a scar lower down. It can increase your risk of testicular cancer by 5 to 10 times. And having testicular cancer before increases the risk of developing the cancer on the other testicle. However, cancer in both testicles is extremely rare. So what are you looking for? A hard pea-sized lump in the testicle itself. And let's get the record straight. There's no pain whatsoever with the early stages of testicular cancer. So if you do find something odd, don't write it off because you feel fine. That's not how it works. Symptoms you can look out for include a collection of fluid in your scrotum, swelling or heaviness or enlargement of your testicle, a dull ache in your lower abdomen or pain in your lower back. But don't panic if you get a pain in your back with no other symptoms. It's likely to be a sports injury and nothing else. You might even have pain or swelling in your chest. Keep in mind that a lot of lumps and bumps are nothing to worry about. It could be a million other things. But if you do find anything unusual or new, get to your doctor straight away and get a second opinion. And if it is testicular cancer, there's a 99% chance of being cured if you catch it early. Now to tell you a bit about how to examine yourself, we've got one of our greatest supporters.
I'm always thinking of ways I can help out the team. My biggest responsibility is checking Dwayne's balls, and I take it very seriously as it is life-threatening. I've even got my nails altered to make it easier. It's something intimate we share together actually. It's our time away from the stress of professional football. It's best done after a shower or bath, standing up, definitely. I like to put something lacy on, but that's not necessary. I also like to light a scented candle, but if you can't afford that, it don't really matter. Just nice to warm your hands up over a candle before you get in there. Do you know what I mean? But you can always use a radiator. I gently cup Dwayne's platinum balls, that's what I like to call them. I like to get an idea of the weight of them. Then, I gently roll them between my thumb and my forefinger, checking for any lumps or bumps or changes in firmness. Even if your man's got balls of steel, then they should still feel smooth and nice and squidgy, like a hard-boiled egg without the lumps. As you examine, you might come across 2 little lumps at the back. Don't worry about these, they're just the tubes which lead up to my favourite bit. If you do come across anything that feels a little bit different or out of place, then make sure you go to the doctor, get it checked out.
So you guys are here to do some training. It's all about catching it early. If you're diagnosed with testicular cancer, it's not game over. A lot of footballers and sportsmen have been affected by testicular cancer and have gone on to have massive careers. Of course, Lance Armstrong, but Jason Cundy, Neil Harris, Jose Francisco Molina and Alan Stubbs. So what if it is cancer? Well, the surgical procedure is standard and has been done millions of times. They won't lop them off with garden shears, you won't walk with a limp, you'll still have your sex drive, and you'll still look the same down there. And if all goes well, you get a sponge bath off a hot nurse. You can still go on to have a great career, and you can still go on to be a dad. Testicular cancer doesn't usually affect your ability to have children. After all, a double-barreled shotgun can still fire off one cylinder, if you know what I mean. So give it a go. You know the facts, you know how to check them.
For more information, visit keepyoureyeontheball.org.uk.